Dr. Khoo, this might be a very broad question, but what exactly is heart disease?
Well, heart disease is a constellation of conditions that affect the heart and the vascular system. So a more accurate term to call it would be cardiovascular diseases. These include coronary heart disease or coronary artery disease, where there's impairment of blood supply to the heart as a result maybe of arteriosclerosis or further diseases that affect the circulation to the heart. You could have arteriosclerosis, which is a generalized condition that affects all the blood vessels in the body and involves accumulation of plaque in the blood vessels. And this could affect the heart, the brain, the kidneys, muscles. You could have congestive heart failure, which is failing of the heart as a result of multiple conditions that affect the heart muscle. Atrial fibrillation is a very common abnormal heart rhythm disorder. And strokes would be included under the category of cardiovascular diseases, where you have damage to the brain as a result of circulation problems to the brain. We lose more than 900,000 lives a year to this, and of which more than 550,000 lives lost are in women.
Why women?
Women are still today not as aware of their risk from dying from cardiovascular disease as men. A lot of this stems from the early studies, which were centered around men, and that led to the myth that women do not have heart disease. Well, heart disease affects men and women equally, and it affects all races equally. So long as you're aging, you're developing heart disease. Many studies have also found that if you educate women, it may actually be more effective than educating men. It's because the women were running the household. So the men will come home and they will eat whatever the women was cooking, right? What the studies found that if you educate women, and if the women decide to adopt the healthy heart lifestyle, guess what?
The whole family.
The whole household becomes healthy. And I think this is what we're adopting now, to try to educate more women and make them more aware that they are equally at risk for heart disease as men.